Right. Okay.
Good morning, good evening, each and every members of Acharya Nidana Academy. Today we are starting with the Mastermind series, which will begin by one of my own mentor and teacher, who has the rich experience of more than 40 years in the subject of Roga Nidana, and he will be interacting with us on the approach to Jvara, an Ayurveda perspective. We are not giving much the delay, so we will be hearing the sessions with the Prof B V Prasanna sir. So probably thing is, dear members, you can take a lot of the notes, or if you want to have any kind of the clarifications, better put in the chat box, or otherwise you can ask at the end of the session. So now let us begin with the session on approach to Jvara and Ayurveda perspective from my own teacher and mentor, Professor B V Prasanna sir. Please, sir.
Thank you, Dr. Gopi Krishna, for your invitation to talk about Jvara now. Really, because you're also helping me from the point of view that all these can be again and again reminded by us now. Otherwise, I have already stopped teaching for last about 10 years now. It's almost nearly to 10 years. So to have it, to have a contact, to understand this, though we are practicing this in the field, still, unless we have no fundamentals, it is very difficult to come across with the, whenever we come across with the patients there. That is the reason, especially nowadays, what is going on is, we are hearing from different parts of the country that Jvara has become so much common in many parts of the country in different reasons. So, for example, nowadays the people are hopping, especially in the regions like the Bangalore. People are having dengue like anything. Almost about 45 or 50 years back, dengue was unheard in Bangalore. Everybody was telling that it is a disease from the Calcutta and other areas, East Bengal or Calcutta areas, and this was not at all prevalent. But now it is not the case. Any fever can occur anywhere in any part of the world because of the migration. Now the challenge is this: how best we understand all these conditions in relation to Ayurveda. First, let us understand that if all these conditions were there earlier, are there here now, right, even nowadays, and will be there later. That doesn't mean that it's all new conditions that was not there earlier, that's why it's not possible for us to understand. No question. All were there and it will be there. So from that point of view, if you look from Ayurveda point of, if you look from Ayurveda, how best we can be able to make out this? Any form of the Jvara for that matter. There is a word of caution. Jvara is not a fever. Or it is not simply a fever. That's why do not try to equate fever to the Jvara. If you want to identify that, you say that fever is a one small part of the Lakshana of Jvara. That's all. The reason is simple. Fever can be measured by the instruments that are available nowadays. But you cannot able to measure the Jvara in many times, many situations from the instruments. The only instrument is the human being. So the better we prepare from the point of the observation of the patient, the better we are in a position to identify the features of Jvara. Clinically, when we come across with a patient, our thought must have to be concentrated or focused upon certain aspects. Number one, first aspect is when the patient comes to us and he explains his difficulties, we have to be in a position to know when exactly the patient was relatively normal before the suffering of this Jvara. This is the situation to be known. That's why history plays an important role here. First, since how long the patient is having this, what is the period of interval between this and the other situation when it has occurred earlier? I've been in a position to come to a clear-cut physical diagnosis from the point of view of Ayurveda. Because when we look into the features, Nava Jvara is different, Stomach Jvara is different, Irida Jvara is different, Jvara as a Lakshana different, Jvara as a Upadrava different, Jvara results in the form of Arishta Lakshana is different. In all these situations, we cannot equate that, oh, this is the Jvara, so this is the treatment. No. Before going to the intervention, first decide, that's why I said that, first decide the onset of it, then come back to the course of that, then decide what it may take the course later. We do not intervene at the right stage. So now we will start from one situation known to be the Taruna Jvara, or in the other word, you can call it as Nava Jvara. So if you want to identify a Taruna Jvara or a Nava Jvara, the patient must have to come to us with certain features from which he was totally free for a longer period of time. So it must be any features that may be found in the patient should be of a recent origin. It's a matter of days, we can call that, not even week. I am using the word matter of days is the fact that he must have many times suffered from that so-called the Pura Rupa without the onset of the Jvara there. So because of Pura Rupa, he might or might not have neglected it. And at the time of your his appearance to us, he may have developed the Jvara Lakshana, Pratyapa Lakshana. So that means the time lag that has been taken from the onset of a Pura Rupa to the Lakshana may be different from a person to person. But in most of all these situations, as a Pura Rupa, the foremost history that he may give us is, he started first with the features of Aruchi or Agrimanya. For the last 2 or 3 days, I didn't have any inclination to take the food normally, which I was doing that earlier. And I did not notice that it may be because of the Jvara or something like that. Simply I continued with my work. And from this day, that is after 3 or 4 days of this feature, now we have this problem. Then you have to probe with other features, because that's a prominent feature that he had. Then you have to raise the question in relation to that, possible Pururupa that have been established. Whether he had the features of only the indigestion or ajirana or aruchi or avipata, or even he had the conditions in relation to the interference with his normal activities. Normal activities in the sense that he might have found no zeal to the work. That utsaha is reduced for the last 2 or 3 days. His inclinations are altered. Altered inclinations in the form of what Charaka clearly says that Jvalana Atapa Vaivambu Vichadvesho. So this in relation to the Varam's environment, the patient may find difficult to adjust to the Varam environment or at times cold environment. Varam water to the cold water. Varam's environment within the room to the cold environment within the room. He may sometimes find comfort, sometimes many times he may find discomfort. Such a variations could be made out by him just in a span of 2 or 3 days, and that has made him to be restless. So for that reason, he must have come to us. So that means patient has certain Pururupas before the onset of this Lakshana, that is Santapo Deha Manasaha. That's a Pratyaprashta. Sharira Santapa could be made out, no doubt. By a Spashtana Parisha, you can be able to make out the difference there again. But the next problem is Manasika Santapa, and that's why I said that so far no instrument is readily available to identify the temperature variations in relation to Manas. That's why only we have to depend upon the features the patient presents with. So again, there may be the features in the form of Vaichityata, Arati, and the Glani. Those are presenting features with the increased Sharira Santapa, all that the patient is having the Jvara. Variable that will be found. Only rise of temperature does not expect it to be found there. Because Chakrapani and other people even later comments that there should be a Santapa of Sharira and Manas, generally you have to call it as Jvara, including the Indriya. And even in practice also we can be able to make out that patient's temperament is altered during the occurrence of this Jvara. That's a sign of a Vaichityam. Patient's activities interfered, feeling the sense of the Daurbalya, the weakness, or the lassitude, whatever you call from the present point of view, that is there. Glani will be there. Arati, no interest. Arati means interest, you can call that. Arati refers to no interest in doing the no interest in consumption of the food. In that way, such type of a changes that is obviously found can be related to the Manasantapa. So in that way, the patient has come to us with the Sharira Santapa, with Manasa Santapa. So we can say that patient is landed with Jvara. And as the history clearly suggests the fact that he had not all these features for a long period of time and he was free from those conditions earlier, we can make out that under the heading of a Taruna Jvara. So Taruna Jvara again, where most of these Pururupas continue to occur. And in this continuity, what is going on is, at least for about 5 days from the onset of this Lakshana, patient may be identified with the Annavasota Dushti Lakshana, Udatmasvartas Dushti Lakshana, Pranavasvartas Dushti Lakshana, and Purisha and Mutravasvartas Dushti Lakshana. That's why I can be able to make out that. All that ultimately explains the reason behind these changes are due to the continuous persistence of the armor that was responsible for this. And this was the armor that was developed there starts to migrate and attack all the dhatus, whatever are being found in the body. And because of this increased situations of the Amadosha in the Rasadhatu there, the augmentation of the Svedavasvatas later, due to which there is an increased santapa within the Bhashya Roga Marga, if at all, normally we can consider Bhashya Roga Marga. Because of that, the patient will have a Sharira Santapa. Aruchi will be there, Avipaka will be there, Uddara Gaurava, the feeling of this heaviness over the abdomen may be expected to be found there in the patient. Hrudayasya Avishuddhi, how to understand this problem? Can you say that? If you simply translate this. If you simply translate that Hrudayasya Avishuddhi into form of.
Hello, dear members. Please mute yourself.
Son Papa, height. ಅದೇ ಇದು ದೊಡ್ಡವ್ರಿಗೆ ಎಷ್ಟ
Hello, mute ಮಾಡ್ಕೊಳ್ಳಿ. Hello, my dears.
Can you hear me?
Yes, sir. Yes, sir.
Please mute your
Mute yourself, Dr. Balesh. Dr. Balesh, please.
Mute your laptop.
Yes, yes, sir.
Yes, sir.
Because small children, you cannot expect them to hear us.
No, sir. No, sir.
You can hear. Oh, good, very good. Okay, next.
No, sir.
So, from the point of this, what we can call Hrudayasya Avishuddhi, simple or mere translation is the impurities of the heart. No, it's not that. How can we understand this? Understand means, Rasavasvata Dushti is already augmented. There is increased accumulation of Amadosha within the circulating Rasadhatu there. Due to it, as a Rasavasvata Sthana, as well as Pranavasvata Sthana is the similar like a Hrudaya. So there is an impact on the Hrudaya now. That means Hrudaya Pradesha or the chest. So because of that, much of the chest discomforts may be expected to be experienced by the patient. It may be in the form of heaviness, maybe in the form of little respiratory discomfort.
Sir, you can make mute, sir. You can make, you are a host, sir. You can mute the audience. You can mute the
If
audience.
I mute the audience, they can hear.
They can hear, sir. They can hear. You are a host because you can mute yourself. Because I am not a host, I cannot mute the audience. Sir, you are not audible, sir. You are not audible. You are not audible, sir.
Is it okay?
Yes, sir. Yes, sir.
So from that point of view, what is to be known is Hrudayasya Avishuddhi refers that there is a just discomforts. The just discomforts in the form of feeling of heaviness over the chest one, or feeling of discomforts in the form of some respiratory discomfort like a little breathlessness may also be experienced. All that suggests that there is a Hrudayasya Avishuddhi. Then normal activities in the form of the sleep piece, Chandra may be there, so that the patient feels inactive, more or less. All that will be the continued feature. And more than everything, the Jvara will never come down. That's why Jvara Vegaha, Avisargi will be there. So this Avisargi means that the increased situations of conditions of Santapa will be expected in relation to the Manasik Santapa also. Patient becomes more and more irritable. Patient's regular temper, Sharir Santapa may also be increased there. That is the reason we can call that as a Avisargi Jvara. Because what is the reason? The reason is all this makes us to understand that Jvara is in the conditions of Amavastha. That's why in the Tarada Jvara, at least for about 4 or 5 days, the patient do have this condition of Jvara Lakshana. So the Jvara Avisargi will be there. Dosha, and the reason, why the reason? What is the reason for this? There is Doshanam Apravartanam. The Avisargi, one, Doshanam Apravartanam is the reason. Dosha Pravritti is a most important aspect to be found out in the body. Because dosha should never be augmented somewhere else, giving rise to the Avarta Lakshana, Avarta Dosha Lakshana there. So this Marga or that Avarana may brings about the functions of dosha that are affected and gives rise to abnormal features in the given area. Now, as Rasadhatu is there and in which all these Ama doshas are circulating over the body, so this causes the apravartanam of the doshas elsewhere. So that's why Jvara Avisargita will be there. How to counter that? We'll come back to that later. What is necessary to counter now to understand that? So Jala Vega may be increased. Dosha Apravartana may be the problem. Gradually, the patient starts with the salivation will be increased, like Lala Prasyaka may be there. Or in the form of Shut Nasha will be there. Or Asya Vairasya. See, these are the defense activities. Now, Asya Vairasya and Shutanasha are the defense mechanism here. Reason is simple. Because of this, the reason because of this, the Anuvasvatas where the ugly that is found is absent now or minimal now, because this Rasadhatu simply does not influence on the Anuvasvatas. Instead, it is in a position to forcibly throw the I can call that Ushma from the Jatara Pradesha to elsewhere like a Bhakya Roga Marga, where Rasvasotas is found all over the body. Because of this Santapa starts to increase in the Bhakya Roga Marga. And in that Bhakya Roga Marga, where the Dhatus are there also the Ushmata found within the Dhatus level, within the Bhutagni level. So because of that, there is a relative increase of this Ushmata in the Shakas, but relative deficiency in the Anavasvatas are in the Kostana. So because of that, the person is not in a position to have the inclination to consume the food. That's a Shutnasha or Asya Vairasya will be the outcome now. We can definitely just look at any patient having the Jvara, just prior to 2 or 3 days or from the onset of the Jvara, patient does not have an inclination to consume the food. It's a defense mechanism. The body wants to see that whatever the products that are not required to the body must either to be digested or to be thrown out. These are the options that are there. So to facilitate that only, Anavasvata starts to strike there. Make a strike means it will becoming a non-functional or impaired function in the form of Agrimandya or Shutnasha. So because of all these conditions, gradually the patient may develop. Reason is nutrition is not reaching to them because nutrition itself is not qualitative because already it has been completely studied with what you can call the Amadosha there. Hence, the Dhatus also suffer from this deficiency. Due to that only, Stabda, Supta, Guru Gatratvam will be the problem. Gatra Stabdata, Supta Gatrata, or Guru Gatras. It is always the experience of the patient. Patient says that all these are not active, no, actively not possible. Feeling some degree of heaviness all over the body, feeling some degree of heaviness in the head, feeling some head pain in the head, aching sensation in the head, all that are the features related to this. And Suktata is again a Rasvasotas Dushi Lakshana. Rasvasotas is not in a position to fulfill that prenanam to elsewhere over the body like the extremities, due to which Suktata may be expected. So patient will come across with all these conditions very frequently. Then One problem that arises here is Doshanam Apravartanam will be the problem earlier as I mentioned, but Bahumutrata may be a feature in Amadosha, Amajara. How is it possible? Bahumutrata is the reason of the impacted Sweda elsewhere over the body now. Already Amadosha is generating much of the fluid there because of the similarities between the Amadosha and then the Kapadosha and then the Kleda there. That one is already there. But this Kleda is not eliminated in the form of a Sweda because there is an Avroda in the Sweda process. Then where should it be eliminated? So the only elimination part is the Mutra. That is why in the Amajara, Bahumutrata may be the one of the. That's why the patient may say that frequency of micturition is increased. So naturally, frequency is increased there. Invariably, the quantum of Mutra may also be relatively increased there. So in that way, when the Bahumutrata Lakshanas are being seen, what about the Purisha Srotas now? In the Purisha Srotas, as the Amadosha influences even on the Purisha Srotas, Ama Purisha Lakshana will be found. That's why now with Jirna. So there is no Pakka Purisha, there is an Ama Purisha. Formed stools are not expected to be found there. They are impacted with the Amadosha there. Hence, the Apakka Purisha may be found there again. Apart from that, one possible feeling is, in spite of that, the patient will not have extreme weakness in the body. That's why Nachaglani, because it is just of a recent onset, doshas are not affected in the form of Lina was the so far. Because of that, Dhatuksha is not very prominent here. Let us remember that in the Navajvara, doshas, the dhatus are not prominently affected. But because of this same Rasadhatu circulates all these dhatus, features of the Dhatu Lakshana may be found there again. That's why Nachaglani may be there. If these things are there, usually we can call that as the stage of a Navajvara in which Amajvara Lakshana may be found. Either the doshas, you can call that exacerbation is minimum or moderate, or if it is severe, that decides whether the dosha, that the jvara may be in a position to come down or continue to take place. It is an important thing to everyone. So, if the proper intervention is made, if the doshic exacerbation is not very prominent, if only one of the doshas are prominently affected, then the chances of intervention will help the patient to make himself in such a way that the condition may be transformed into a Pachamana Jvara. If it is Sanipata Jvara, if it is a condition where Bahudosha Avastha is already found there, then even it may not be in a position to come back to the Pachamana Avastha even after 5 days. And that too, even in spite of intervention also, this may continue later. That point should be remembered. Next, usually after the 5 days, what is going to happen? Kala plays an important role now. If the intervention is proper, then all these Amadosha starts to become minimal due to the Doshapata. This is important. Doshapata has to be ensured to see that Niramata should be attained. If once the Niramata is there, to counter that condition is easier. That is the reason. Before going into the Niramata, Doshapata tends to make the patient to have sudden rise of Jvara or temperature, or the Jvara Lakshana together. Even Manasika Jvara Santapa, Sharirika Santapa Lakshana will be there. That's why Jvara Vegaha Adhikaha. So it doesn't mean that, oh, Jvara is increased. Why not to interfere with paracetamol? No, wrong. you are doing the injustice there. The reason is that is a defense activity taking place in the body now. To see that all the dosha paka will be ensured due to this ushmata there. So Jara Vega will be there. Then Trishna, Pralapa, Shvasana, Brahma. Because of this increased Jara, patient will have increased thirst or Trishna, increased conditions in the form of Pralapa. Remember that again. That is the reason why the Manasa Swatas is affected. Because of this rise of temperature, because of this Manasika Santapa, patient will have Pralapa. He has no control over his speech. He has no able to make out what is normally speaking or irrelevant speech may be there. Shwasakrucharta may be very prominent because in the earlier situation only there was a Hridaya Savishuddhi. But patient now that develops the features of Brahma. If these things are there, ultimately along with this, then the process of remission start to take place because during this course, Mala Pravrti will be there. Remember that. That's right. Mala Pravrti refers to Dosha Pravartanam. So Dosha Pravarta, Apravartita Dosha, Dosha Namcha Pravartanam was there, start with a Pravrti. Due to this Pravrti, most of the times, this may be eliminated now. Eliminated the form of a Utklesha. That's the reason vomiting may be very frequent. Chardhi may be found there. After the chardhi, the temperature usually come down, so the jvara will come down. Pravritti Utklesha Pachamanasya Lakshana. So in that way, the Pachamana Jvara Lakshana features may be there from the day 6 to 7. From day 6 to 7 after the onset of jvara, these lakshanas will be there. By the day 8, patient will attain the stage of a niramata. That means dosha paka has already been resulted. Patient distress has come down. Patient's anavasvata functions are tending to become normal. Because of that only, that can be made out from the point of patient's experience and expression like Shuddha Kshamata. He says, Lagatvam cha Gatranam. No, sir, today I'm feeling better. How do you say you are feeling better? Now my activity is increased. My activity is comfortable. I don't feel the same feeling of heaviness all over the body, same feeling of what can call the pain all over the body. No. That's why Shuddha Kshamata, Lagatvam cha Gatranam. And what is the other feature? Jvarana Mardavam. Jvara Mardavata. So that earlier, Avisargi Jvara. In the second stage, the features in the form of Jvara Adhikaha. In the third stage, Jvara Mardavata will be there. So in these situations, usually, Doshanam Pravartihi Ashta Hai. That means Dosha Pravartana completely becoming normal on the day 8. So till these 8 days of the course of Jvara is referred in the form of Navajvara. Remember, 8 days is not an absolute period. It may extend up to day 10. It may extend up to day 10 from the point of view of the nature of the dosha that is responsible for leading to this jvara. If at all it is a kapha dosha, then the dosha pravartana may take place on the 10th day. Because kapha dosha and ama dosha are very similar to each other, it takes its own time to remission, and hence dosha pravartana is also delayed. So on the day 10, patient may have the features of nirama jvara if it is a kapha pradhana jvara. If it is a pitta pradhana, it's in between, it will be found. Why I spoke all this in length is, this helps us to frameline the treatment. It's very simple. Sir, we are Nidana people, why should you bother about the treatment, miss? These principles will make us to know the what stage the patient has come to us. If the proper intervention was made or not can be made out. Through that we can be able to make out the condition of the patient at the time of his presentation. Otherwise, it's difficult. For example, Anganam, Swedanam, Kalaha, Yavagaha, Tikta, Yavacha, Tikta Korasa, Pachanani, Avipakwanam, Doshanam. Look at it. This is a line of treatment. Avipakwanam, Doshanam, there is an Amadosha description. This line should be followed. Let's see the Navajvara. It is not the line of treatment to be followed in all Jvara. Remember that. It is especially for the Navajvara. Highlights the importance of Langanam, Pachanam, Swedanam. So now, see, look at it. And then allow the Kala to play its own role to bring the dosha pata. That's a Kala. Don't expect that you are given in the form of Langana, you attribute Langana for 24 hours, given a much feeling of Yavago on the day one only, and then given in the form of Svedana, in the form of giving rise to some Svedakaraka Dravya on the day one. By 24 hours, if a patient comes down with a fever, means no, that's not the right time. Kala is important. What is the Kala? It takes nearly 5 days in spite of your proper intervention to convert into Pachamana. You are facilitating that by Langanam, Swedanam, and Kalaha. And then Yavagvaha, till that 5 days, these are the measures to be followed. Yavago helps to make the Swedanam. Yavago helps to make the patient to have the prana within him, which will give the bala to sufficient bala to the patient. Bala is very important because Charaka clearly explains that how long the Langana should be done and in whom Langana should be conducted. There is one feeling, in the general society. Langanam, Paramaushadam, until Ella. I don't know which is that. Langanam or Langanam, we don't know that. Samudra Langana is also there. Here, Langana is contraindicated in many conditions of the Jvara, even in the Navajvara. Remember that. In the Vata Prasanna Jvara, Langana is not really ideal. Usually, in the Vata Prasanna Jvara, Langana is not ideal. Instead, there may be requirement of a Tarpanam there. Tarpanam there. So that's the reason that care should be taken. And even at that time also, Agni Deepaka Pachana Aushadas also to be given along with that. But in the situations like the Jira Jvara, Langana should not be done. Vishama Jvara, Langana is not indicated. That means it has a very limited scope, with a prominent scope so that it can prevent the onset of other conditions of Jvara later. So then, after the Langana Chikitsa, how long that should be done? How long that should be done? The problem is that he explains clearly there. It should be done as long as the life activity is not interfered. Because I already mentioned that it takes 5 days. Our text says 5 days of Langana should be done for 5 days because the Amadosha will be there all 5 days. So if you do not give anything to the patient for 5 days, no need to give any medicine after day 6, right? That's the reason. That care should be taken. Tarka very, very practically explains this. First, find out his normal activity is not affected. Prana avirodhina chainam langanena upapadayat. Your Langana line of treatment should not interfere with life activities. If you find such life activities are somewhere interfered, stop that Langana. Find out an alternative path. The reason is, the advantages of Langana is already there. Those Langana Kshayam Nite, Doshe, Shut, once a Shut Shamata will be there. So Sandukshate Anale, Anal Sandukshana will be there. Dosha Kshaya will be there. So Langana should be done. But how? This must be kept in mind. So anyway, normally taking into consideration of all this, Langana is done. Need not be that it's for 5 days. Start with the Svedam name. Then Yavagu and Tiktarasa should be conditioned. But Yavagu can be given from the day one only. There also contraindications are there. In the Madhyotita person, in the Vishapidita person, Yavagu is not ideal. That should be taken into consideration. Then only you have to decide whom Yavaga should be given or whom Yavaga should not be given. Later, Chitta Rasa Prasana Dravyas are to be given. Right? So, when these things are to be done, Chitta Rasa usually in the form of a Kashaya will give. Kale Shadahe Tite, clearly fixed. After the day 6, Kashayas are to be encouraged to the patient. Till that, Langana, Svedana, Kala are the 3 line of treatment should be followed. So if the day 6 means, is it on the 7th day or immediately on the day of 6 means? Actually, Chakrapani comments there. It's not necessarily that it's on the day 7. After the 6 days, give Lagvanna Pratibhojitam. On the day 7, give the Lagu Ahara. Then start with the Kashaya, the day 8. Remember, though Charaka says, Kale Shadayatite, we don't know. After 6 days, we saw after how many? So not necessarily on the 7th day. From usually, because Niramajata will be attained on the 8th day. So from the day 8, you start with Kashaya Pana. There also importance is to remember. What is that Kashaya to be given? Kalpokta, that is Kalpasthana Kashayas are to be encouraged. Not Kashaya Rasa Prasana Kashayas. Example can be given. Aditya Kashaya is not ideal there. Why Harit Kashaya is not ideal after the day 8 or day 6? Reason is, it causes the stabdhata there in the body. Haritaka is Kashaya Rasa. So, any Kashaya which has prominent of Kashaya Rasa should be avoided at the time of deciding the indication of Kashaya. Then what type of Kashaya should be given? Deepana Pachaniya Kashaya should be given. Pramatyas, we can call that. Tikta Rasa Pradhana Kashayas have to be given. That's the reason. Kirata Kitta Kashaya, Katakarohini Kashaya are all such factors that have to be necessarily adequate. That's why I said, Charaka, Tiktaka Rasa Yevacha, Pachanani, Avipakpanam Doshanam, Amapachaka, like it should be other factors. All these helps that doshas from Amavastha to be converted into Niramavastha. In case Kashaya Rasa Pradhana Kashaya is given, Charaka immediately cautions that that is one of the reasons for the onset of Vishama Jvara later. Because of again the dosha stabdhata will be there. Because of the dosha stabdhata, dosha aparavartanam will be there. This reminiscent doshas of Navajvara converts into Vishama Jvara because of our mismanagement. That is the reason. Clearly, it informs not to give such factors or such kashayas which are prominent of kashaya rasa. That should not be given. So now, till this period of maximum period of 10 days, we can say that it's a situation of a Navajvara. And we can be able to make out that. And as they mentioned the important fact that patient should be free from any of these symptoms at least for a long period of time. What is this long period of time is? If the patient is already having certain inherited or acquired disorders, from this, the Jvara may be very frequently appearing in him. And at that time, say for example, for about fortnight or 15 days, if the patient doesn't have any fever and he comes to us, no sir, I was very all right till 15 days. Okay. Before that, what happened? No sir, 3 months back I had one problem of the liver failure. I have again had some fever and I recovered. Okay, what about 6 months back? No, at that time also there was some damage with the kidney and I had some fever. Now I have come back. If those things are there, that patient who presents with us should never be diagnosed as Navajvara. Because already the patient had some conditions where the doshas are already in the form of a Leenavastha in him. either because of little management or the conditions that are not responding to management might have just subsided the features, but not completely relieved him of the doshas. Because of that, recurrently the patient suffers from the Jvara, and he started to change the doctor from one to another. You are lucky or unlucky, you will be landed with that patient. Isn't it? At that time, your diagnosis should be such that it is not a Jvara. He must have come from some other conditions of Jvara, which may be in relation to a Punaravartaka Jvara. Because already Avartanam is taking place in him. That's why line of treatment is different now from that patient to this one. Well, the second question that arises is, after 10 days, what happens? Patient will become normal? No. Patient will never become normal. Because at that time, he clearly has the Charaka is non-committal. Remember that. He never gave a false assurance. That is called Nirama Jvara Lakshanam. Shukshamata Lagutvam Chagatranam Jvara Marduvam Pravartihi Ashtaho Nirama Jvara Lakshanam. That is a Nirama Jvara Lakshanam. It's not that the patient has ultimately come out of Jvara Vijvaratvam Lakshana. That's the difference between Vijvaratva and Nirama Jvara. So now the thing is, patient should be given such a Jvarahara Kashaya, the one, such a Balya Kashaya or Balya Aushadha Dravyas, whatever you can consider with you can find the ideal, and then proper form of foods or Ahara. So both Ahara, Aushadha, Vihara should be in such a way that this Jvara should not repeated. So you can present a time relapse run. It should not be repeated. If we do not do that, on the day, usually what happens is, nowadays the certificate is very important for them. So on the day 8, if you give a certificate, this patient is fit enough to work, attend the duties at the good time. Again on the day 10 or day 11 or day 12 or day 15, you may come back again. So again, I started with mild temperature or something. Who is responsible? We were responsible because though the patient has Nirama Jvara Lakshana, though the patient might have the features of Vijvarata Lakshana, Asanjata Bala is one of the reasons there. The Bala to counter this onset is not completely present in the patient now. That's why make him fit enough means Parihara Kala should be followed. Ask the patient to go with some more days of rest, some more days of dietetics, some more days of whatever the procedures you may explain to him in the form of medicines. Then only the patient attains the Swastavrata, Swasthata. Then you can certify the patient is healthy. Certify. This is very important because many times we may fail to do that. Next condition is, assume that your all planning was good enough, still the patient do not respond. Even after the day 12th or 13th, again the Jvara starts to take place. It's possible. Charaka never said that patient will become normal after 9 days or 10 days. No. In case Jvara does not respond, then it may turn out into Vishama Jvara. So in the situations like the Vishama Jvara, the whole pattern of this clinical features starts to become altered. Why this alteration is found? Earlier, in the situations like the Navajvara, the Amadosha is simply affecting the dhatus in such a way that persistence of that made Agni Manda or Dhatu Agni Manda there. But now, as the days progress, as the dosha exacerbation is too high, immediately they ultimately reach to the dhatus and continue to And the continued to later, it continued to be stagnated in such a way that is called as Lina Dosha. Dhatvantaravastha. Doshas are ultimately becoming stable there. And this excited doshas may be situated in the given situations like the rasa, rakta, mamsa, or any other dhatu. Depending upon that, if they found other opportunistic causes, suddenly exacerbations may start to take place. That is the reason all Vishamajvaras in common depends upon dosha kala balabalau. Dosha, dusha, kala, and its bala or abalata decides the different characteristic features of Vishamajvara. That's why the word Vishamata has come from the Vishamarammo Visargitvam. This so-called exacerbation or remission of the Jara is not same in all these conditions. How many types of Jara are mentioned in relation to Vishamajvara? It is 5 in nature. Like it may be in the form of Santata, Satata, Nedvishka, Satiyaka, and the later part is known as Chaturthaka Jara. In these 5 types of Jara, the reflection of the doshas on particular dhatus are being identified. There is some difference in the opinion between the Samajvara and Vishamajvara in relation to Rasa Dhatu there. But Charak has clearly mentioned it's also part of Vishamajvara there. Hence, accept that it is a Vishamajvara. Reason is simple. There, the Jvara will be found throughout the course of the illness with no remission when a Rasa Dhatu is affected. That means the flooding of Amadosha into the Rasa Dhatu is continuously found there again. Due to this continuous flooding of this Amadosha into Rasa Dhatu Gata Santata Jvara will be found there. And there also, either the proper intervention or by the nature of the doshas themselves, where it attains the Pakavastha within the span of some time, then the patient may be expected to be relieved from all the signs and symptoms of Santataka Jvara. So Santataka Jvara features are nothing but the features related to Rasadhatugata Jvara. Please remember that. So Rasadhatugata, that's why it says that Acharya Nidana Sapdala. Jvara is 7 types in nature according to the Acharya Nidana. So Rasadhatu is affected here. So Rasadhatu Gata Jvara, because Zalina Dosha is the Rasadhatu now. As it is in Rasadhatu and Aharaha Gata, that means all the 24 hours this circulation is there. The impact of this Amadosha all over the body is also found there again. So continuously the Jvara may be there at least for 7 days or 10 days or 15 days. Maximum period mentioned is 15 days with some exceptions, which I would like to come to that later. So naturally, in this span of 7, 10, 15, in fact, are depending upon the Vata dosha, Pitta dosha, and Kapha dosha there. Because Kapha dosha is taking its own time to exacerbate and remit, so 15 days maximum time limit is mentioned. So now, normally now, what you can expect is a Kapha Pradhana, Tridoshaja, Vishamajvara means the total span from the Navajvara to this condition is almost 25 days. 50 days of this Vishamajvara, 10 days of the Navajvara. Add to that, in 25 days, the patient will have one or the other problems. So now again, when once these situations like the Vishamajvara where Rasadhatu is affected, Rasadhatu Lakshana Jvara is found there, that is called as Rasadhatu Gata. Here, after the day 25, if at all it's a Kapha Pradhana Vishamajvara, I'm using that word particularly. After the span of that is limited days, whatever I mentioned, usually doshapata ensues, and if the doshapata ensues, the patient will become normal after a maximum of 25 days. But situation may not be the same in all the patients. At times, what happens is, dosha nirharana does not take place at all. Because whatever the treatment that you give is either inadequate or insufficient or not in a position to accept by the patient because of so much of virulence of the doshas. When that condition is there, on the day 25, the patient dies. Hantiva, what does it mean? That means the death of the patient may be due to such an exacerbated doshic features. This is one thing. At times, this rule may be broken. This rule may be broken because you have already started the treatment. Doshic prominence started to respond, but it did not respond completely to the treatment. So this incomplete line of treatment make the doshas not completely eliminated, not attain complete normalcy, due to which the period of this occurrence may tend to continue further. How long it continues further is not known. It depends upon the patient's response to treatments later. So at times, this is not an absolute period of 25 days, maximum 25 days. It may be relative, but usually in 25 days, response either recovery or termination may be found. If not, durhruteshu cha dosheshu, clearly Charaka says that if it is an incomplete elimination, incomplete excited doshas, then it may continue to patient may suffer even over a longer period of time. In that way, the Santata Jvara is explained. I think I don't want to go into detail of Satataka, Anyadushka, Trutiyaka, Chaturtaka. All this depends upon the timing of the Jvara. Remember that. That's why Santataka Jvara has been used word Nishpratyanikaha. Why that word Nishpratyanikaha has been mentioned is, there is no time lag of remission of doshas till that specific period of time. So because of that, it is not in a position to accept the treatment properly also. But in other conditions, it is sapratyanika. Sapratyanika refers that during some interval of time during the course of the illness, patient will be little having attained a little comfort because this Jvara Santapa is reduced in him. Example can be given. Say, for example, in a Satataka Jvara, usually it is a Rakta Dhatu Gata Jvara Lakshana will be seen there. In that condition, as the doshas, excited doshas, tend to take its own time to reach, and it usually experienced by the patient that there is a rise and fall of temperature in between 24 hours, 2 times may be found. 2 times the Jvara may be increased. After some lapse of time, Jvara will be decreased. Again, in the same 24th of within the 34 hours, one more episode will be experienced by the patient. The reason, Sushruta gives the reason for that Durastha Dhatus from Rasa to Rakta Mamsa made, it takes its own time to get exacerbated at a given time, and that time ultimately makes them to exacerbate and diminish after the spell of its own condition. Why this, what can be called the spell is exacerbated and decreased is because due to the doshic conditions. I already mentioned, Kala plays an important role. If it is a Vata Pradhana, Tridoshaja, Vishamajvara, where it is a Satataka in nature, it exacerbates during the Vataja Kala. And it remains after the Vataja Kala. The same thing happens in the day as well as in the night. So during the Vataja Kala of the day, during the Vataja Kala of the night, exacerbation will be seen, and later it provides another opportune time to reach to that excitation in the second day of the Vata Kala. That's right. This possibility of exacerbation remissions are being found in the all other three conditions. Hence, it is known as Sapratyanikaha. So this timing is also not uniform. I already mentioned that. It is not there exactly right 6 p.m. to 10 p.m. or 3 p.m. to 7 p.m. Not that. It all depends upon the dosha pradhana avastha in the patient. So if it is vata pradhana, vata kala may be more. Pitta pradhana, pitta kala at that time the exacerbation may be. If it is kapha pradhana, sannipata jara, kapha pradhana lakshanas may also be there. If the all the three doshas are exacerbated, what is the fate now? Then the jvara may occur depending upon the timing which may respond or not. The timing which may ultimately contribute to that or not will decide that. So there are maybe jvara may be there, but mild and the high temperature may be there depending upon that lag of time. So in that way, the Vishama jvaras are explained. You please look into that time interval later, because in Anya Dushka only one time in 24 hours will be seen. And then the other conditions like the Trutiyaka and Chaturdaka, and alternated days in Trutiyaka, after 2 days of interval will be in the Chaturdaka. That's the difference. So this part of Vishamajvara is something different from the Navajvara, as already mentioned now. So in this situation, we have to observe the patient's condition properly and to see that dosha prakash should be ensued in such a way that you should not get excited, because ultimately it may end up with that worsening condition of the patient. Patient may go into different episodes of that. So that has to be prevented. That's right. Vishamajvara Chikitsa is different there. There, he never says that Langana should be the line of treatment, but he says different forms of preparations in relation to Khira. But Khira is one of the important patya, and also the of Khira options are considered to be useful there again in the Vishamajvara. Well, this is one more situation that can be found. The next situation is in relation to Punaravartaka Jvara. Or, yeah, even before that, we can go with one more information that's in the form of Jirna Jvara also. Better word is Jirna Jvara. When to say that the patient is having a Jirna Jvara? When you have to say that it is a Jirna Jvara? I already mentioned that. Maximum time lag of Vishama Jvara is 25 days, 25. Any Jvara that may persist again and again and again, even after the intervention, if it does not respond, it may end up with the Jirna Jvara Lakshana. Because at that time, the Leela Dosha Avastha will be there. Because in the Navajvara, there's only the Stambhita Doshas. In the Vishama Jvara, the Leela Dosha that's already there. And later, this Leela Dosha and its activity of the Leela Dosha persists to continue, means it may end up with the Jirna Jvara, which may be termed after the day 26 or somewhere else. Now the question arises, why do you want to know or make the difference between a Vishama Jvara and Jirna Jvara? In the Jirna Jvara, Dhatu Pata is continuously taking place. The doshas have not responded to the treatment, whatever being given earlier. That's why Charaka clearly says, especially almost all Jirna Jvaras are Siddhosha Jvara themselves. By that, because of that, only response may not be seen. During that time, earlier measures in the form of Kashayapana, in the form of Langana, in the form of that, patient may have developed the Atirukshata there. So this Atirukshata may bring about the Atidhatukshaya elsewhere over the body. So because of this Atidhatukshaya, hypersensitivity even to the medicines later. So because of that, patient's condition may become worsening. Dhatukshaya will be the problem with it, because of that Pantaragata Dhatusthita doshas are responsible for this. Then, now level of treatment starts with different form of Gurutas there. In one situation, Langana, second is Kshirapana Sevana, third is it will be useful to see that his Vedic Samatha can be regained back. Can be regained back. Problem is, in the Jivana Jvara, most of the times it may start to recur again and again and again, as you have seen in the Vishnu Jvara. So this problem are all identified within the gambit of Punaravartaka Jvara. So the Punaravartaka Jvara may be resulted as an outcome of incomplete remission due to Navajvara, or there may be complete remission but inadequate dietetics followed by the patient after the Navajvara, then the Punaravartaka Jvara may be there, or because of no proper response of the treatment to the Vishama Jvara, Punaravartaka Jvara may be there, or as one of the criteria or the character features, Punaravartaka Jvara may be seen as a Jirana Jvara. That is why in the diseases like the Madhumeha, in the diseases like the Kushta, in a disease like the Rajayashma, in the disease like the Kshatrajakasa, in the disease like the Kshayajakasa, in the disease like that of the Santamaka or Pratamakashwasa, in the disease sometimes like a Visarpa, Punaravartaka Jvara may be very frequently found. That's the reason we should be in a position to identify those conditions and see that the patient should be made beneficial. How can we identify that patient is having a Punaravartaka Jvara due to the either Navajvara or Vishama Jvara or Jirna Jvara? The first condition that may be made out is because of the outcome of a Navajvara where patient fails to stick to the dietetics. Because there is a strict Pathya Sevana is there with regard to the Navajvara. That's why it says, Sajjaraha Jvaramuktasya Vidahini Gurunica Asatmyani Annapanani Viruddhanija Varjayet. All these are to be given up because patient has not yet regained the proper bala within him. If immediately after the remission of the Jvara, like a Jvara Vyokta Lakshana, like Vigataklama Santapa, Avyatam, Vimalendriyam, Yuktam, Prakriti Sattvam, or Vijvaratvam is there. So I can do anything and everything. If the patient feels that or follows that, he may end up with a Punaravartaka Jvara. Same Jvara may be again recur and recur. That's why it says, Asanjata Balo Yastu Jvara Mukto Nishevate. The patient who is relieved of the Jvara, not yet regained the Bala, if at all, he started with Varjam Etan Navartasya. Varjam, which is considered to be contraindicated or not advised during that situation of a convalescent period. If that patient follows such dietetics, he will be definitely suffer from the Punaravartaka Jvara. This is the first character feature we can call. Secondly, I already mentioned earlier in the Vishama Jvara, doshas are not completely eliminated, but they are not sufficient enough to take the life of a person on the exact days mentioned like 7, 10 or 15 days in a Vishama Jvara. There the problem is Durhruteshu cha dosheshu yasya va vinivartate. Doshas are not completely eliminated. Still reminiscent of the doshas are there within the body. In such situations, swalpena apacharena, even a little indiscretion with his activities or the food will lead to the Punaravartaka Jvara. That's a Vishama Jvara itself is a part of Punaravartaka Jvara, I can call that, because I have mentioned that repeatedly and every day this Jvara will be there, either twice or once in a day. In that, that's even that can be a part of Punaravartaka Jvara. You can say there is nothing wrong. But here, in that condition, even after the interval of 7, 10, 15 days, if the patient continues to have this feature, means it is that can be considered as Puraravartaka Jvara because all that excited doshas are not completely eliminated from the body. Swalpena apitarena, patient will have the problem. The third situation is in the form of Jeerna Jvara. Jeerna Jvara is also a part of Puraravartaka Jvara. Reason is Chirakala Pariklishtam Durbalam Hina Tejasam Achirenaiva Kalena Sa Hanti Puraragatana. Chirakala Pariklishtam. Already 25 days are over. Already 40 days are over. Because of that Chirakala Pariklishtam. Because of that only. Durbala is already there. Hina Tejas is one thing factor to be known. Agnimanda is permanently be the part of the patient now. Then the patient will have the Achirenaiva Kalena, which is a short spell of time also. He may come across to the second, third, or fourth episodes of Jvara there again. Or else, when once the Dhatu Paka is continuously resulted and taking place, as we have seen in the Jeerna Jvara, that is sufficient enough to bring about the Puraravartaka Jvara time and again. That's the reason. Asavapi paripakvam paripakam dhatusheva kraman malaha yanti jvaram apakurvantam tatha api apakurvantam. Look at that. Because of the dhatu paka, already there will be the dhatusheva kraman malaha. All these doshas are completely being bound to the dhatus there. Because as they are bound to dhatus, they are not completely eliminated and usage to this type of Puraravartaka Jvara due to this Durbala Chetasam. Due to the Agni Darbalya and Agni Mandya there. That's why I say, in that condition, if patient develops Dinata, Shwayatu, Grani, Panduta, Annakamata, or Raktasota Dushi Lakshan in the form of Kandu, Utkota, Pidaka, all that will be there with extreme degree of Agni Mandya. So in that way, we can be able to make out that this condition is in the form of a Puraravartaka Jvara. Why I spoke these things? Is it only theoretical? Nowadays, the science is so much advanced. We can be pinpointing our diagnosis with the established investigative procedures. Then why should we unnecessarily harp on these shlokas and then come across with that? I agree to some extent to this situation. But just for a minute, you think that even in 2024, if these investigations were not there, what would have been the fate of the medicine? Once think like that. What would be their course of action to identify a disease? Then you will be in a better position to understand that. Yes, even from the clinical point of view, clinical procedures, whatever the method of diagnosis mentioned in Ayurveda holds good. Don't keep in your mind that is it a possible dengue, is it a possible chikungunya, is it a possible rat bite fever, is it a possible enteric fever, is it a malaria? Forget that, you know nothing about that. You know nothing about that. You just think from these aspects. Response will be the same. Your treatment, line of treatment, follow that. Identify the clinical features in the patient and go with that. From the Navajvara itself, you are in a better position to manage the patient. It doesn't mean that 100% vertical cause responses will be there. I already mentioned there is no chance of that 100% responses. If that was the case, there was no need for anybody to say that all cases can be cured. If at all a Sallipata Jvara is there, if at all it's a Hila Teja, if there is a Shota is found in the patient Sallipata Jvara, the patient will die. Tarka clearly says that. So first observe that. At what stage, at what time the patient has come to us, what would be his situation, if at all certain medicines are given. So this type of things may help us for a right diagnosis, and from that right intervention can be made later. So I think I can complete this because I've taken plenty of time. Thank you one and all for very patiently hearing. And if there are certain questions, you are all welcome. Whatever I may be in a position to know, I may respond to your queries. Thank you.
Thank you, sir. Thank you for the very elaborative and thought-provoking interaction, sir. I think the listeners are going to get benefited a lot in this particular manner in knowing about the actual, how to know about the Vyadhyavastha, specifically Roga Nidana as such, that is of importance that we need to know about the Vyadhyavastha. Jvara is one such condition where even the Ayurveda, even the Western medicine people, they are having the difficulty in identifying actual Vyadhyavastha. That is why it is considered one of the what do you say, that the very difficult area which can be managed in the even in the present era also. And regarding the one of the major aspect, it is being said by the sir that Jvara is the mutually exclusive disease, in the sense there are certain things. Vidhi Samprapti is being of the Jvara is being mentioned, Sharirika and Manasika Jvara. In case of Sharirika Jvara, there may be a possibility of Antarvegi Jvara or Bahirvegi Jvara, or there may be a possibility of Vataja, Pittaja or Kaphaja Jvara as such, or there may be a possibility of Prakrita or Vikrita Jvara, or there may be a possibility of Sadhya or Asadhya Jvara, or there may be a possibility of Saumya or Agneya Jvara, or there may be a possibility of Sama, Pachamana or Nirama Jvara, or there may be a possibility of Navajvara or Jena Jvara, or there may be a possibility of Punaravartaka Jvara. So in the sense, you need to identify what actually the particular person is suffering from that particular disease, because each and every Vyadhyavastha, it is having its own importance as far as giving the line of treatment is concerned. And in this regard, so let me ask the audience if they have any of the questions. They can pose either by raising the hand, or they can keep the questions in the question box. Any questions?
Just whether doctors are there or not.
There, sir.
Huh?
There, sir.
Somebody may have this Tarapi Glani and then leave the place. Because you can control any tapa, but very difficult to control manastapa.
Sir, am I audible?
Ah, sure.
Sir, one question is that what about the selection of Rasaushadhi in this Vyadhyavastha in person suffering from Jvara?
Yes. Association can definitely be considered only after the identification of a Navajvara number. In Vishamajvara, and even in the conditions like the Jilda Jvara, Puravartaka Jvara, Rasaushadhis can be definitely taken. Why I usually do not recommend in Navajvara is, as far as possible, the intervention should be prevented. That's the reason even Langana is only line of treatment has been Langana Svedana Kala for 5 days is the reason for that. Even now, But today, you know that most of the investigations and its responses will be seen only after day 7. Before day 7, most of the disease cannot be identified through any other investigations. It's common in many disorders. I don't want to name any of the diseases because I told you, I would like to stick to my system first. In those conditions also, they take 7 days to exile incubation and all that people, whatever the people, they say that. So when that is the situation, intervention with knowing nothing about the possible onset of the course of that, we stick to these presents. And I have mentioned that definitely there are good medicines in regard to the Rasaushadhi that are to be taken into consideration for Vishama Jvara as well as the Jirana Jvara, Punararthaka Jvara. Okay.
Yes, sir. Any other questions?
Thank you.
Okay. So, any one or the two audience. So, say what are the, would you like to say something?
You conclude.
Yes, sir. Any other queries? No. Sir, I think we will end the session, sir. It gives me immense pleasure for the Prasanna sir who have accepted my invitation to give the right and appropriate information which is needed specifically for the Jvara, which is most difficult subject for the learners, because it is having that particular vast illness, that is the Vyadhyavastha, that is very, very difficult to identify. And the Prasanna sir has given the whole gist, just like the very in a simple manner, so that it is just like the Kvata is being made in the form of the Rasakriya. So that means we can able to learn this particular subject in an easy and understandable manner. Thank you, sir, for the interaction.
Thank you, Dr. Gopishna. Apart from that, I thank all the listeners who patiently heard so far. In fact, I deliberately left out many of the information that was supposed to be given. I know that it's not possible within 1 hour. I just say, for example, Dharana Moksha, I have given up that. And certain form of information that regard to the procedural way from one step to another procedure, that is being deliberately left from my name because it's Roga Nidana prominent condition and the time limit should be about 75 minutes. So during that time, I wanted to cover such information, and that may be beginning for the people to think further about that. I think if it all that it is done, my effort may be successful. Thank you very much. Thanks a lot. Okay.
Thank you, sir. And thank you all the listeners who have patiently heard this particular session. Thank you, sir. Thank you.